Last month, the number of Palestinians killed in Gaza surpassed 30,000. That number comes from the Gaza Ministry of Health. It does not distinguish between combatants and civilians. Because this number was compiled by a Hamas-run ministry, and other agencies have not had access to the enclave to record their own figures, it's been subject to skepticism. The Jewish magazine Tablet said the death numbers were faked. Israel's UN ambassador said they were exaggerated. And in October, President Biden said he had no confidence in numbers cited by the Gaza Health Ministry.
No notion that the Palestinians are telling the truth about how many people are killed. I'm sure innocents have been killed, and it's the price of waging a war.
A number of academic institutions have since then come out with studies that found the ministry's numbers to be credible and, if anything, conservative estimates.
Even despite everything and the challenges, this is an incredibly data-rich environment compared to most other humanitarian emergencies. Before this crisis, UNRWA had an electronic health system that was quite extraordinary. It was really, really detailed. They had apps that people could use for antenatal care and for vaccines, and so it was very sophisticated.
Gaza's health ministry relies on death certificates from hospitals and morgues, which is then collected into a computerized system. These numbers have historically held up to findings from other organizations and even Israel's own figures. In the war that erupted in 2014, the ministry's numbers were largely in step with those by the UN office and Israel's foreign ministry. The latest war in Gaza began in October, following a Hamas-led invasion of Israel, when fighters killed 1,200 Israelis and took more than 250 hostages, according to Israeli authorities. Israel retaliated with a bombardment and ground assault to the Strip. 1 month into the war, Gaza's health ministry said the Palestinian death toll surpassed 10,000. A research letter that same month by doctors at the London School of Hygiene and Tropical Medicine found the ministry's numbers to be credible. A separate letter by Johns Hopkins Center for Humanitarian Health found the same.
It's difficult now to know how comprehensive the numbers are now compared to what they were previously. But if anything, it's likely undercounting at this point because the access to these hospitals and therefore the documentation is not the same as it was previously.
In more than 5 months of fighting, the Israel Defense Forces estimates it has killed between 11,500 and 13,000 militants. Civilians that are still alive, particularly the thousands trapped in the north, are struggling to survive. And many missing Gazans have not been counted in the ministry's death figures. The Civil Defense Emergency Services estimates 8,000 people are still under the rubble.
Initially, after strikes, you would have emergency workers racing to these sites when they could. You would have the whole community come out and just desperately trying to dig people out. But there was often ongoing strikes. And also, these are concrete, large structures. To get people out, you really need heavy machinery. And there was a huge lack of heavy machinery and also a huge lack of fuel to run this machinery and of even getting that machinery to these strikes. So you have a lot of people just digging out by hand, effectively.
After initially backing Israel unequivocally, the Biden administration has voiced growing frustration with Israel's conduct of war in Gaza, including concerns about the civilian death toll.
He has a right to defend Israel, a right to continue to pursue Hamas, but he must pay more attention to the innocent lives being lost as a consequence of the actions taken. He's hurting Israel more than helping Israel by making the rest of the world, it's contrary to what Israel stands for.
But Washington has continued to provide Israel with weapons and diplomatic support. As the war continues and Gaza's healthcare system crumbles, there's a fear that more and more deaths will go uncounted.
The main sort of central repository for the reporting system was in Al Shifa Hospital, so that when that was destroyed, the main systems for collating and bringing that information together electronically were destroyed. One thing that we can expect is that probably the quality of reporting and the completeness of reporting has probably gone down over time. The ministry itself said that, they were not including, for example, bodies that were in the rubble and not found. So if anything, we thought it was probably an underestimate of the deaths.
The Gaza Health Ministry recently put out a sort of Google form trying to get a sense of how many people may be missing. And that's about all they have at this point.